This is a meeting of the Northampton Board of Health on December 19th, 2024. Um, we'll introduce everyone after we have public comment. Is there anyone here for public comment? Please raise your electronic hand, which you could find under the reactions button, or send any reaction you would like if anyone's here for public comment. Jane Carey? Kelly, can you unmute Jane Carey, please?
Yes.
Suzanne, could you be a timer, please?
Yes.
And Jane, you have 2 minutes. You're welcome to unmute yourself.
All right, I think I'm unmuted. Can you hear me?
Yes, we can hear you. Go ahead.
All right, thank you for listening to my concern. I have a concern to share with the Board of Health. I live in a downtown-ish neighborhood, and there is some extremely loud car stereo noise that comes through my neighborhood, especially late at night. And it's really impacting my health. So I thought I would talk about it, see if you folks have any suggestions. It's impacting my ability to sleep at night and relax at home. The stereos are sometimes so loud that my walls shake. And the part that really bothers me is when it's between 11:30 p.m. and 6 a.m. because I'm trying to sleep. So I'm trying to get the Board of Health to help maybe come up with some ideas. I know that finding a car that's driving around can be very difficult, but the sound of the bass from the boom cars travels very far, and it really is very invasive. I have a couple of suggestions. Since I have 2 minutes, I guess I'll share them now and then see what the Board of Health thinks. Some of my suggestions include stricter laws, drivers with large, loud car stereos who are disturbing the peace should be fined at least $1,000 and possibly lose their cars like they're doing in some communities. By the way, I did share a couple articles with Donna, and if anybody wants me to share them, I can. Another suggestion, getting law enforcement to be very proactive and supportive and actually ticket people who are offending the noise ordinance laws. Another suggestion is educating the youth regarding how powerful their technology is and how intense noise can negatively impact their neighbors' health. And then a couple other suggestions. I know this one is a little out there, but I thought about hiring a private investigator to find the culprits. I think there's really only a couple of them, but I'm not sure because it's really hard to, I've gone out at night trying to find them and it's really hard. The other thing is Cara Leeper, who's the CEO at Hampshire Heights. I think we need her as an ally. The noise comes from
Time's up.
Hey.
You can finish your sentence.
Okay, the noise comes from that general area much of the time. And I know that when I first started, it was about a year ago when this started getting out of control, and I was working with Cara and she was helpful. And anytime she did something, it really helped keep it quiet for at least a couple weeks. But she has stopped communicating with me, and I'm just not sure what to do.
Great, thank you. In this format, we don't respond to you right now, but we'll definitely consider your concerns. Evan's iPhone, can you unmute yourself?
Okay, you should be able to hear me now.
Yes, go ahead.
So this is the first Board of Health meeting that I've attended, and I am concerned mostly about SARS-CoV-2 and what is to be done about it. I have a concern that there are, and I don't mean to be insulting in any way to anyone, but there are no minutes posted from any of the recent meetings of the Board of Health. So it is impossible for me to see what has been done in terms of actionable items from previous coronavirus COVID-19 conversations. So I need to ask the question, what is being done, and ask that that be provided in future information. My understanding is that the Board of Health advises, e.g., has authority over the Department of Health of Northampton. My question is, what authority, methods, and in what ways is that authority being used to take action to stop the spread of the ongoing pandemic? My two main concerns are, well, my main concern is that masks are not being adequately encouraged from what I can see on either the CDC, mask.gov, or our website, on the Department of. So I believe that the Board of Health and the Department of Health should be rescinding, fining, or taking away people's license to operate for schools and hospitals that are not taking the appropriate measures that we all know are appropriate based on the numbers in the wastewater data.
Time.
Thank you for your concern. And as I said, in this format, we are not responding to you tonight, but we'll certainly take your concerns into consideration. Thank you for speaking up. Is anybody else here for a public comment session? If you're here for public comment, please raise your electronic hand under the reaction button. I don't see anyone else. Oh, Cynthia, your hand is raised.
Yes, it is, because I wanted to say something. So is that permissible at this time?
It's
not a comment. It's not.
If you're coming as a member of the public, yes. As a board member, no.
Okay, so perhaps
wait till we open the board meeting.
Okay, thank you so much, Janet.
All right, being that there's no more public comment, we will move on. And would someone like to make a motion to open our Board of Health meeting?
Move to open the meeting.
Thank you. Is there a second?
Second.
Thank you. Comments or discussion? Thank you. All in favor? Cynthia?
Yes.
Janet?
Yes.
Suzanne?
Yes.
Joanne? Yes. Thank you. Tonight we have all of our board members present. It's Dr. Suzanne Smith, Dr. Cynthia Swopis, Janet Grant, and Dr. Joanne Love and myself. Can we have the staff from the DHS please introduce yourselves? Amy, do you want to start?
Sure. Good evening. Amy Hutchins, Director of Environmental Health.
Scott?
Scott Hoiberg, the Executive Assistant for the Department of Health and Human Services.
Thank you. Kelly?
Kelly Constantine, Department Assistant for Health and Human Services.
Kelly Hughes?
Kelly Hughes, Public Health Nurse.
Donna?
Donna Bowman, Health Inspector.
Great. Is there anyone else here from the department that I didn't catch? Great. Thank you all. And this session is being recorded. Cynthia, did you want to say something before we call on Councilor Maori?
Yeah, just because we have something in the chat from an individual, and we also have the other comment. So I just wish we could sort of address specifically. I know this could, open up many, many doors, but just to guide our public as to what the next steps are. It sounds to me like Jane Carey already contacted Donna, so there is a connection there. And also just some response to Evan, and I'm not sure how we can do that, but with 2 comments, there might be a way we can do it. And I'm also just registering a concern if the minutes haven't been posted. I never look to see if they are because we get them automatically. So just want to make sure our public knows that we're interacting and responding. So if anyone has any other different ideas, but I think it's really important that we do that.
Kelly, Constantine, do you know when the last minutes were posted? Which month?
I can look.
Okay, we generally do post the minutes. It takes another meeting to approve the minutes, so it's not, doesn't happen right away, so there's definitely a delay. But all the minutes should be there within a month or so of the meeting. And I guess I would say for Evan, a better venue might be to speak with someone directly, or one of the public health nurses, speak with someone directly in the Department of Health. Because the board format doesn't really lend to conversation. Okay, we will move on. Councilor Mayor, I thank you for coming. And I guess you're going to give us an update on the local shield law that you've been working on.
Yeah, good evening. It's great to see you all, be it someone else's meeting. Yeah, I'm going to keep it brief because I think I sent you the executive policy order that we ended up with, and the mayor is going to be presenting that, and I'll let you know when that happens. But I thought I would come and just at least let you know what's going on, which is that I believe that most of you were here when I came to a meeting before, and we discussed the healthcare data protection ordinance. I'll just go over that briefly. There's a state law, the SHIELD, we refer to as the SHIELD law, that protects healthcare data, specifically, in light of reproductive health care and gender affirming care, from extradition, from AGs from other states that might request it, and kind of empowers municipalities to say no to that. The assistant AGs, even with the presence of the state shield law, recommended that municipalities also fortify our own ordinances, because the state one really only specifically referred to police departments. So since since Roe was overturned, we've been I've been wanting to pass some sort of ordinance for Northampton, and it's taken a lot of iterations and a lot of folks. We've worked with Reproductive Equity Now. Janet's been instrumental. Thank you, Janet, for keeping it going. And what we found was we came up with an excellent ordinance, but there's this gray area in Northampton about the powers of city council. Mainly, we cannot really give directives to the city departments. If we didn't have a supportive mayor, I would keep pursuing it, because there is a gray area that we can stipulate that city resources not be used in a certain way. So if you could possibly write an ordinance to couch it that way. But after a year and a half, I was like, well, we have this mayor who I know is supportive, so let's just go and meet with her. And I'm just really grateful for her dedication to the issue of reproductive health rights, but healthcare in general. So I met with and in this time period, initially we passed a resolution in council supporting the Roe Act, which is another set of ordinances protecting reproductive health care at the state level. And then this fall, I passed a resolution declaring Northampton a sanctuary city for transgender and gender diverse people. And the reason I did that, and I was clear, is really to kind of set aspirations for our community, but also expectations for our city departments and staff. And so I wanted to lay that groundwork, and then went to the mayor and said, can you issue an executive policy order that will cover both the healthcare data, concerns around reproductive health and gender affirming care? And she said yes. And so she quite quickly issued this executive policy order. I'm extremely grateful for it, and we hope to present it. She's going to kind of present it to council probably in January, and talk more about it. It is her order, so I can certainly answer some broad questions, but I would probably go to her or the Solicitor Seawald for specific concerns or questions. So I think it does the job that we need right now. And, this was back in the fall, and to be honest, I'm very grateful for it now, but even if we had had a different outcome with the election, the reality is, those seeking to threaten reproductive health care rights and gender affirming care rights are very well funded, and they're going to be here, whoever is our president. So, but I am even more grateful to have it in place with the unknowns coming with the change of the administration. So it just basically fortifies the state law and makes it very clear that no city employee or resources or contractors can violate, can share this healthcare data, which of course is illegal, but this really spells it out. So some of this is kind of redundant in the sense that it's already unlawful and there's HIPAA. But it gets legally, more complicated when AGs from other states are asking and demanding. So we wanted to make it easier for city employees to say, "Hey, I can't do that." So that's where we're at now. And and I really want to thank again Janet and all the folks who worked on this, and the mayor for being really willing to write this up. And I would love at some point to think about other ways we could fortify protection of healthcare data and reproductive healthcare as well.
Thank you so much. Questions from anybody? Questions or
Yeah.
comments?
I have a question. So you said that the mayor is going to speak with the council in January, but is this executive policy order already on the books now?
It is.
Okay.
It's on the books and has been sent to, I believe, all the department heads. And so it's really just a kind of part of, I think, of this order is really just letting people know it's there too. So that's what we're going to do in January. Just she did a little presentation about the immigrant sanctuary city concern. She did that a few weeks ago, and now we're going to go over this in January. But it's been in effect since the date. I could look at the issue date, but in the fall, October maybe.
I don't think I've seen it. Would you be able to send it to us?
Oh, I did, Dr. Levin. I'm sorry you didn't get it. I sent it to your
I don't think I
email.
remember seeing it.
Yeah, I didn't initially because I didn't know if the mayor may be joining us and would want to. So I sent it to you, and you can screen share or send it, or you could share it with or you could just share it by email with the board.
Okay.
So I just a comment just on what you said about just HIPAA itself. I mean, my understanding is that HIPAA is, well, I'm probably not stating this correctly, but it just seems to me that a executive policy order that impacts all city employees really goes beyond what something like HIPAA can do. So I just really want to thank you so much, Counselor Maori, for all the work you did to pursue this, because I think it's incredibly important and it will probably save lives given this era that we're moving into. So thank you.
Thank you so much. That's good to hear. It was really legally complicated. We had a whole part, that's the part you might remember about so-called, I don't want to call them crisis pregnancy centers, but fake pregnancy centers. And we had a whole part about that. And we did end up taking that out because we don't have that issue here, and it was really legally so complicated. But I would love at any point for any of you to reach out to me if you see an opportunity to fortify any of this at another level. But thank you so much. It was a long process.
Counselor, as I understand what you said, this is currently as an executive order from the mayor.
Yes.
And that expires when this mayor leaves office, correct?
That's it could expire, and that's something to think about. And that's generally why I like ordinances, because ordinances do not expire. So that's something we need to think about. That's a great point. I
Right.
appreciate you bringing that up.
I think of this more as a temporizing measure until it becomes more permanent. So I was going to
Yeah,
ask
that's a good point.
how you're going to pursue that, but it sounds like you're already doing that.
Well, I'm actually still looking into how to write an ordinance. I'm still looking into this idea of, can we just say that you can't use city resources to kind of prosecute somebody? And so I'm still pursuing that, but I think that's a really good point. It's an election year, so I appreciate you bringing that up, and we should think about that.
Thank you.
Yeah, thank you. Good point.
Anyone else? Questions or comments? Well, thank you again. I will look it through my email, and if I find it, I will send it around.
Yeah.
And mhm.
Well, thank you, Doctor. Yeah, if you send that around, that'd be great. And people could just email me with any questions or concerns. And then Doctor, I will send you the date when, just so you know, when the mayor's going to present. And maybe I'll even send you the little recording of it, just so you all have it, so you don't have to go to the whole meeting.
That'd be great.
Okay.
Often our meetings are the same night as city council. So not always.
Right,
but
exactly.
Yeah. Okay. Well, thank you so much for coming.
Okay, thank you so much. Thank you for all your service, everyone. Bye.
Bye-bye. Evan, I don't know if you've raised your hand again, but just to let you know, in the format of this board meeting, we don't call on the public at this time. So as I suggested earlier, I'd recommend that you contact someone at the Department of Health or the public health nurses to discuss your concerns. Okay. Kelly, would you like to tell us what's happening in health?
Hi there. I think I'm going to try and share my screen, see if I can do this. If I do that. Whoops. I think that's the wrong thing.
We see that you've
Oh, you
started
do.
screen sharing, but we
See
don't
that?
see anything yet.
Can you see?
You have to choose which screen to share.
Yeah, it's saying Zoom ended unexpectedly. Am I still on?
You are,
All right, so I think,
unless you had two of them open.
oh goodness. I think I'm gonna abandon this and just talk to you. I think that makes more sense. Okay. I could figure that out. I apologize, everybody. You can see me. I'm on the screen.
Yes, but all the boxes are very small because it looks like there's supposed to be a document here, but there's nothing in the center.
Okay.
There you go. Okay.
Okay. All right. Sorry about that, everybody. So I was just going to really, all it was sort of snapshots from our website. So anyone who is interested in looking at where we're at with respiratory virus season can go to northamptonma.gov to the Division of Public Health Nursing, and we have our respiratory illness updates posted there. Looking, sort of zooming out at the state, the summary of the overall respiratory illness for Massachusetts, kind of looking at the impact that it has regardless of which specific disease it is. Massachusetts, it's still in the low category. And that's, about where the country's, all over the place a little bit with that. But, in Massachusetts, we're doing pretty good. Looking at emergency room visits for Hampshire County, which is just the measure of how many people are seeking medical care for each of those illnesses at the RSV, COVID, and flu. We've seen an increase in Hampshire County in flu and RSV, no change with COVID. Now, of course, if you go to our website and you look at our wastewater data, we've had a pretty significant increase in wastewater. And that's showing at the very high level for Northampton. But it's important to remember that wastewater does not tell us a total number of cases. It's rather just the amount of the actual, virus for COVID circulating within the wastewater. And those shifts up and down over a point of time kind of tell us whether cases are increasing or decreasing. But again, not the number of people that are sick. So it can be used as a predictor, but not to tell us how many cases are in the Northampton area. And another really important thing to note is that Cooley Dickinson Hospital is part of our catchment area. So we're going to see a higher concentration within our area as more people present to Cooley for care. So they're not actual case counts, it's just the amount of virus. And there is a large community hospital within our catchment area. So we're going to have a spike, but again, it does show a trend. And, as we approach colder seasons and temperature, people gathering indoors, we anticipate that we're going to have an increase in respiratory illness coupled with kind of the waning effect of vaccines if people haven't stayed up to date. And it sort of just underscores the importance of ensuring that our community members are up to date on their vaccines and they have access to the resources that can help reduce transmission.
Ellie?
Yes.
I'm sorry, I'm sure this is on the graphics that you're not able to present, but when you talked about a spike in the wastewater, was that a spike of a particular organism or is that across the board?
For Northampton, we only measure our COVID-19 in our wastewater. I apologize, I didn't clarify that. When you look at the CDC and I think the state website, they give you the breakdown of the three. But
Yeah.
for us, we only get reported for Northampton specifically, we only get the COVID-19. So I think over the last handful of weeks, there was a significant increase. It kind of makes sense if you think about Thanksgiving, people getting together, and then following that. But, those are the trends that kind of happen historically. But yes, that's specifically for COVID that we had that increase. Yeah, so keeping people safe, I think is the question. How do we do that? Staying on top with your vaccines. At the health department, we do offer COVID and flu. There is an RSV vaccine, so those are the three respiratory illnesses most people are talking about now. Definitely, community members should communicate with their primary care providers or doctors, even a pharmacist, if you have a question about whether or not you're eligible for RSV, as that's a little bit more nuanced. But in general, everybody should be getting COVID and flu vaccine. And we do have that here within the Northampton Health Department. So staying on top of your shots, having good hand hygiene, respiratory hygiene, covering your mouth, wearing a mask, having your air ventilation in your home up to date. And if you're sick, staying home, stay home, wear a mask, talk to your doctor, seek treatment. If you're sick and you do go out somewhere, you have a mask on, keep distance. Social distancing is still a thing. We don't have to, go back to where we were during the pandemic, but having good hand hygiene, respiratory hygiene, wearing masks and testing if you're sick. The guidance for that hasn't changed for COVID, or it's sort of a general respiratory guidance. So stay home until you're fever free for 24 hours and feeling better. And then, over the next handful of days, 5 days, take precautions. I had pulled up some information on some data, which is really, I think we're proud of here at the health department, the vaccine efforts that we've had within Northampton and regionally. And if you look at Northampton alone, there were 16 sites that we gave vaccines and administered over 1,000. We administered 1,122 COVID and flu shots. So 1,122 vaccines were administered since September in Northampton at 16 sites. So that's pretty good. We were, you look at the numbers for a health department across the state, and other health departments aren't giving as many vaccines as we are. So I think that we're really proud of that. And then regionally, we administered 2,543 doses of vaccine across 37 sites. So we're doing really well. We're proud of the work. And on top of that, we've also given 113 vaccines to individuals and their caregivers in homes across the regions, specifically targeting those who face barriers with accessing vaccines. So people who can't get out, they don't have to be homebound, like you can't get out of bed. If you don't have a vehicle, or if, if there's any barrier for you to get out and get a vaccine, we want to help you with that. So that information is on our website. We'll continue to have clinics, throughout the rest of the season. I think that, interest has sort of waned a little bit. Most people, we've done really well, but, that 6-month mark, I think now we're at who's eligible next. So the latest COVID vaccine recommendations are for everybody to get 1 dose. If you're 65 and older, you're up to date when you've received 2 doses 6 months apart. And people who are moderately to severely immunocompromised can consult with their primary care or their healthcare provider, of course, and they are eligible to receive additional doses 2 months after their last dose. So in anticipation of that second wave of eligibility, we're going to continue to have clinics. Council chambers seems to work really well for the community. So we'll be putting up those clinics, as we get there. And currently the health department is offering Pfizer Comirnaty COVID vaccine for adults, but if people are interested in getting any other of the manufacturers like Moderna or Novavax, retail pharmacies in the area have had it. And if you've recently had COVID and you don't know if you should be getting your vaccine, you can talk to your doctor, but you may delay getting your vaccine for 3 months following illness. But, based on, certain factors, you may want to get it sooner than that, but that's when you should really communicate with your doctor about what their recommendation would be. I'm bummed I couldn't share my slides with you, but it's just, a snapshot of the work that we've done. And in other news, not regarding respiratory illness, where the DHHS is plugging along with our Healthier Northampton campaign. So I think it was launched in October 22nd was the press release for that. And the goal is to reach 5,000 people, getting 5,000 community members to respond. It would be great if we could get more. We're closing in close to 1,000. So we've got more work to do. We're offering people be eligible for a raffle to win $100 if you participate. There's flyers up all over the community. If anybody has any questions, they can call, the DHHS, speak to a nurse, speak to really anybody. I think all of us, whether you're an inspector, a DCC responder, a nurse, everybody's all hands on deck trying to get the survey out there, because we want to know more about what people in the community identify as a need and how we can help them. And then, of course, move forward with your help too, with policy and program development for that. So that's all I got.
Excellent. Thank you so much.
Thank you.
Any questions or comments for Kelly?
Kelly, thanks so much. And I just wish we could find ways to get that survey out there. Would love to get to that 5,000 person goal. And I'm sure you've tried as much as you can, but if there's anything you can think of and how we can help, neighborhood listservs or whatever.
Have you connected with Cooley? Can they put them in their waiting rooms?
That's actually a good idea. I'm not quite sure. Scott and Kristen Dearborn, who's one of our other program coordinators, they've really taken up the work of outreach, and we do have a big long list, and we're working our way through it. We're not done with the list, so we may not have gotten there yet, but that's a great idea. And Amy too. There's Amy. She just popped up on the screen. So Amy's been very helpful with that as well. But we do have a lot more work to do with outreach.
And I imagine on your list would be contacting through all the public schools.
Yes. Dr. Bonner was so gracious in allowing us to put out I think it's called Parent Square, is the system that communicates to all of the families for Northampton School District. And they sent the information out for that right before the Thanksgiving break. And I think that we saw a big increase in respondents after that. So those communications, we've done a code red notification as well. Trying to think, we've had a few other big pushes. So yeah, we'll continue to do that. I think it's really helpful for sure.
Is it up online?
It is up online. There's a link on our website. People are welcome to fill out paper copies. If you don't have access to internet and you come across a flyer, there's a QR code on there. I know that can be, sort of a turnoff if you don't utilize that technology. You can call, the main number, and we have people within within DHHS that can help you, complete it over the phone or come out to you and complete it on paper. So we want everybody to have access however they need it.
Great.
Yeah.
Great work.
Yeah, thank you, Kelly.
Thank you.
Yeah, it's great. Good.
Any other questions or comments for Kelly? Great. Thank you so much. All right. All right. Now we have a continuation of a previous hearing. I'm just going to, let's just find this. So to go to our hearing, we need to open the hearing first. Would anyone like to make a motion?
Just a question, do we have to close the meeting first before opening the hearing?
I don't know that.
Well,
We're still in our meeting, I think.
okay.
And then within our meeting, we're going to a hearing. That's my guess.
Move to open the hearing, and if we have to close the meeting, we'll close it.
Thank you. Is there a second?
I'll second it.
Okay. Any discussions? All in favor? Cynthia?
Yes.
Janet?
Yes.
Suzanne?
Yes.
Joanne? Yes. All right. So we're now in our hearing. I'm sorry.
Good evening. Can you hear me okay?
So we have Mr. Patel and Mr. Porter? Is that right?
Yes.
Okay. Oh,
Yes. Good evening.
Great. So I think we're going to go to the main portion of our hearing. Again, we're going to start with anyone from the department that has any comments. Donna, did you have something you want to give us?
Yeah, I have an update I would like to provide.
Okay.
So I know Meredith had left it off last meeting, that they were hopeful to get the license transfer approved in January. As it stands right now, they're still working on getting the paperwork required for submitting for the transfer of the liquor license. On November 13th, I was notified by the attorney working with the buyer that they were still waiting for a couple documents from the seller. These would be the certificate of compliance from the Division of Unemployment and the certificate of good standing with the Department of Revenue. Once they receive that paperwork, they can submit this to the city, which then would have to get approved by the local licensing commission. The local licensing commission actually had just had a meeting recently, so their next meeting wouldn't be until January 15th. My understanding is in order to be heard in that hearing, they would have to have all this document submitted by the 1st of January. And then if it does get approved by the local licensing commission, it would then be sent to ABCC. Now that process could take anywhere from 7 weeks to 3 months for the ABCC to actually approve that liquor license transfer. So best case scenario, if they get approved by the local licensing commission January 15th, they wouldn't really get approved from ABCC until probably mid-March, potentially into April. So that's kind of what I collected, the information I collected on that.
My question is if the sale, has the sale already gone through?
No, the sale would, my understanding is the sale is contingent on these licenses getting transferred and going through.
Anybody else from the department have anything to offer?
No, I think Scott summed it up pretty well.
Okay.
And just a reminder that what has been looked at so far that they have submitted is a bona fide sale.
Yeah.
Okay. So what you're saying is that if we wanted to continue this hearing, it might have to go as late as March. Okay. Anybody else from the department?
I'm just going to add a little bit more from the documents that I saw, and Scott and I talked about it a little bit today, is that the buyer has submitted their portion of the information. We're really the for the sale, from what it looks like to me, and maybe the attorney or Rakesh can speak on that, is those 2 compliance records that are needed to bring it to the city of Northampton in order to sell. So that's really the seller Racing Mars piece that they're waiting on. That's helpful.
Okay.
Yeah, Madam Chair, I could speak to that if the board would like.
Yep, go ahead.
Yes. So the application is complete. I spoke with Tom Truex, who's representing the buyer on that. They were waiting on 2 pieces of documentation. One is a good standing certificate from Department of Revenue, which is basically showing that everything's up to code as far as taxes are concerned. We have now been able to, the account has acquired that, and that's been forwarded to Tom, and they're just waiting on a DUA certificate of compliance, which essentially is a document through the accountant showing that all of the unemployment tax have been paid. There is hope that they will have that tomorrow. And so Tom's plan would be, once they have the 2 certificates in hand, they'll be able to submit the application by the end of this month in order to get on for that January 15th hearing. So everything is well within the works. I'm also told that their bank loan has been approved. So basically now we're just, going through the process of the buyer, just, transferring the license into their name. But we should have that final piece of documentation to them by tomorrow, according to the accountant.
Okay. Okay. Any questions or comments?
At what point is it appropriate for us to close this and vote on our approval? I thought that we needed to review the documents and the process and give our approval before the sale could be completed. Is that not what we agreed to previously?
Well, I think they don't need our approval to do the sale, but we tabled the hearing so that there would be easy transfer of the tobacco license to the buyer.
Okay.
And so it seems that
Mhm.
it seems
To that end, I could give
Yeah,
some
go ahead. Yeah.
I'm sorry, I could give some clarification on that. So the lengthiest of the processes is the liquor license. And so right now we spoke with the buyer's attorney. They've been focused on trying to get the liquor license before them because as Scott rightly stated, that can be another 2-month process with the ABCC. In addition to that, the buyer has applied for their state tobacco license, which needs to go through the Department of Revenue, as I'm sure you're all aware, first. So once they have that in hand, they will submit, they'll be submitting shortly enough, an application before your board, as well. So that process is being done. contemporaneously with the liquor license. It's just the focus is on the license right now, the liquor, I should say, just because there's that extra component of ABCC from a timing perspective.
Thank you.
But so the concern is we can't close our process if we want to help make a smooth transition to the new buyer. We shouldn't close our process until the sale goes through, and the sale doesn't go through until, February or March. Is that correct?
That's all accurate. And so what we would do at this point is I can continue to keep Scott updated or anybody from your office updated. So certainly when we have a hearing date with the town, when that's on the liquor license, when it's approved, when ABCC approves it. So we'll continue to keep your office updated with any, substantial updates. I'm happy to do that.
So in the meantime, the store is not selling any tobacco or nicotine?
No, and I believe somebody was in the store the other day to double check, but no, they're well aware that that is not permitted at this point. And it would jeopardize their whole entire transaction.
But
Any
the store is allowed to continue to sell liquor.
Yeah, there was no violation. I mean, they're still
Yeah.
operating, but they're operating without tobacco. Yes.
Gotcha. And Don, I'm going to assume that the store is still on our regular visit list.
Yes, we were there this past Monday just to do a follow-up visit and found nothing on site, so they are complying with not having tobacco on site. I will note that the employees who were there in the past are still working at the store, so just make note for the owner that it is the same employees who were there making the sales in the past.
So this has taken a bit longer than we anticipated. I think that's what yeah. And all the paperwork that.
Yeah, unfortunately, it's the liquor license component. I mean, it's just and this is, not to make an excuse for Tom or for the seller, but it's a really burdensome application. I know he's almost all the way there. We've been checking in daily with them. I mean, I think if not for the beer and wine license, then we could have moved this forward, obviously, a lot sooner. But unfortunately, that's a contingency of the transaction, and so we have to hang in there, with this buyer, because in order for them to close, it's required that they obtain their beer and wine license as well. So I think it's moving slower than our folks would like. In addition to, I'm sure, the board, but it's more so as a result of the beer and wine component of it.
Well, I guess my question is for Joanne, like what is the role of the board at this point, or anybody who may know that, in terms of a hearing?
I think it's the same as last time we met, is that we could say that the business defied our rules and we're just going to end the hearing and say that they've lost their license and that's the end of it. But I think that is a hardship for the new business who's going in. So I don't think there's a particular time frame that we need to stick to as far as how long we can continue. We could pick a date, pick that we're continued until February or March, and pick it up again then if we want to. Or we could review it every month, whatever you'd like to do.
So if the sale went through, and we had not acted, there could be no tobacco sales until we came to a final decision about this, correct? That's the piece that we need to rule on, that makes all of the products that had been available in the store available for the new owner.
Yeah, so it's the transfer of the
Right.
license.
Well, I don't see any reason to not give them the time they need, given that it seems like it's moving in the right direction. And Meredith had told us last time, and Scott mentioned as well that, it's a bona fide buyer, which I think was our concern. And the only thing that would give me pause would be if the whole thing fell through and then they start looking for another buyer. But short of that, it would seem we should give them, the time they need to get all these applications and documents in place.
Just like to make sure we're on good legal ground, because we're saying that you can no longer sell these products as we await this sale. And it's taken a little bit longer than we thought. I just hope we're not exposing ourselves to restricting fair trade or anything like that. I just don't know. It's out of my comfort zone. But this, like Janet said, this deal could fall through, and then now where are we at? And in good faith, the seller is trying to sell this business. But if we have the power to do this, to restrict sales, and this seems like the right way for us to go, but I just don't know if we should get some legal advice on this.
I'm not aware of any problem with doing this with continuation of our hearing. The seller seems happy to be on this path. I think rather than just losing the license and giving it up and not being able to sell, this is a better choice for them, which is why we started down this road. But I can check in and get some legal advice about that.
It seems that we are operating within the tobacco regulations. This was the final. This was the highest level of penalty that could be incurred, and that had happened at this particular establishment. So I see us operating. I'm not an attorney, but it seems to me that we're operating within that framework that has been in place for some time. It's also consistent with the state regs as they were modified in November.
Any other questions or comments? Is there a motion?
Motion to close the hearing.
To close it or continue it? To table it?
I'm sorry, continue it. I was closing the hearing for this meeting without an action on the on our ruling, but sure, continue it.
And can 1 second, can I just add, I was just looking at the tobacco regulations. So by them having the 4th violation, it allowed the Board of Health to revoke that tobacco sale. So really, you could do that. The only reason you have done that, and the only reason why you would let them sell and have a new buyer have that license. So the hearing is more to not make that license go away. I'm kind of thinking. It has been revoked for them. So it's okay for them not to sell, but it's to hold that place. It's kind of like a placeholder for that new sale. And we were trying to figure out if it was a bona fide sale. And so I just wanted to give a little clarification.
Thank you.
Which is kind of why I interjected the idea that if the sale were to fall through, I think we have, some different decisions to make. But based on the fact that while this sale is continuing, it would seem to me that we should just continue the hearing and, each month until this is finished.
Just before you finish your thoughts, Suzanne, do you want to continue it and revisit it every month, or do you want to revisit it in 3 months, or?
Well, I think it's impossible at this point, based on the information we've been given, to anticipate correctly when the process might come to a close with the other licensures and all of that. So I don't have any problem revisiting this on a month-to-month basis and getting an update and seeing if it's time for us to make a new decision.
Okay, so
if, for example, if we put this on the agenda for 3 months and something happens in January, then we'll be delaying the completion of the sale and the licenses that go with that even further.
okay, so your motion is to table until the January Board of Health meeting?
Yes.
I second that.
Okay, any discussion? Great, so a motion on the table to continue, table this and continue until the January meeting. All in favor? Suzanne?
Yes.
Janet?
Yes.
Cynthia?
Yes.
Joanne, yes. Okay, great.
Thank you all for your time. Appreciate it. We'll continue to keep your office updated on the transaction.
Third Thursday in January.
All right, we'll be there, and as I said, I'll continue to keep Scott updated as to any developments as well.
Thank you. Would someone like to?
Thank you.
I think we have to close the hearing, even though it's just been tabled. I don't know how we do that.
Move to close the hearing and open up the regular meeting.
Second.
That's sort of what I was trying to say before, but didn't do it very well.
All in favor? Cynthia?
Yes.
Janet?
Yes.
Joanne?
Yes.
Joanne. Great. Okay, we only have one last thing, is our minutes. If I can find them. Here they are. Did everyone have a chance to look at them?
Mm-hmm.
Okay, let me find them. How do I? Oh, sure. Is that it? No.
I just see a little small part
I
of.
know, I have to move it over. All right. Do you see it? No?
Oh, yes, yes.
Yeah. Minutes from November 21st. I took out some details about comments that were made during the public hearing, and just cleaned up some of the few words here and there. Kelly did a great job.
I had a question about, I'm sorry, Suzanne, I didn't mean to.
No, go ahead, Janet.
The part on the nitrous oxide under new business.
Yeah.
Okay.
So the way the last sentence is worded was confusing for me. Our inspectors did an inspection of 29 permitted stores for nitrous oxide and found 6 stores with a nitrous oxide canisters for sale.
They're permitted for something else. Kelly, is that right? So did you say permitted for?
Yes, I
Sales tax?
believe they were tobacco stores and liquor stores, I believe.
We'll just
So
take out the word.
maybe we need to say that 29.
Tobacco and convenience. I think that's what.
Right.
Can I just say 29 stores?
Yeah, or say what kind of stores they were, because basically, I mean, from my notes, I remember we asked it, or Kelly or somebody asked them why they had them, and they weren't really given any good answer for who, why they were selling them. And so part of my question was how the minutes were worded. It felt awkward to me, the wording.
Yes.
But also I felt like I wanted to figure out if there was going to be any follow-up. And I might not remember this correctly, but was there a thought that, or was a letter sent to the stores asking for voluntary removal of those canisters?
Kelly, do you know? I don't think that.
I don't, Amy, do you know?
No, but I tried to keep this current meeting sort of short because we're in Christmas time and thought we could pick this up again in January.
Okay.
I guess there was question of whether we would be, if we wanted to write a ruling or whether Cheryl Sabara had some recommendations on what to do, how to proceed. I think we can look into that for January.
While we're on this paragraph, it creates a euphoric, I don't know what was said in the meeting, but I don't think dislocated is the correct word. I think it's dissociation effect or dissociative effect.
That's dissociative.
Yeah.
How's that?
Okay.
Any other comments about the minutes?
I did have a comment. Back up on the tobacco, the tobacco inspection hearing. It was very, very nice summary of the process that occurs with these compliance inspections. Under standards and procedures, it's the first sentence.
Where are we?
Back where you were.
Back where you were.
Down there?
Back where you were.
Yep.
Back where you were.
Okay.
Back where you were.
Stop.
Yeah,
Yep.
perfect.
Oh, I see.
Perfect.
Okay.
Perfect.
Number 3. Mm-hmm.
Under standards and procedures, youth officers are trained, and if under 18, they require parental consent. In nowhere does it say that the youth officers are under the age of 21. I thought if we were talking about, they have to be under the age of 21 for this to be an illegal sale, correct?
Right. But I guess you're allowed to consent to doing this work between 18 and 21.
Well,
without your parents.
Right, but the compliance is that you're not selling to youth.
Right.
But we haven't defined. I just thought it occurred to me that if we're talking about what happens if the youth officers are under 18, we didn't say what age they had to be.
I think that's
you think that's a given? Okay.
I would think that's assumed because we all know the age of legal sales 21. Doesn't say to a minor.
But they could be 19, and they don't carry their as I recall, Donna, they don't carry an ID, right?
Right.
That's part of the whole deal.
Correct. They don't carry an ID with them. No.
So
it's just that they have to be. Okay, they could send in someone who's 23, and if I understand that is what we have made the stores do, is to check everyone, but the process is to prevent sales to youth. I'm probably taking this off to a tangent that no one's interested in. So
I get your point, Suzanne. I really get your point. Yeah, but I think, I don't know. Donna, I think we could use anyone at any age. We probably wouldn't use a 40-year-old person.
Right. Hampton has we card all regulation, right? So they really should be carding everybody.
Yeah,
Yeah.
yeah.
But the legal minimum sales age is
So down on the bottom here, it says that the violation has to do with sales to an individual under 21.
Yeah.
But to do this work, if they're 18 or younger, they need their parental consent.
Okay.
That all makes
and
sense.
all of our youth are under 21. If they are under 18, then they have to have parental
Yeah, that's what I
Yeah.
thought.
permission. Yeah. Mhm.
I made that assumption. Okay.
I get your point, Suzanne, though. I mean, it's,
Thank
yeah.
you.
Any other questions about the minutes? We're good? Okay. Well, great. I think that's all for tonight. Any questions or comments before we go?
Just if we could get clarification on those minutes, I know, like school committee is spending 9 hours of every meeting going through 3 years of minutes because they somehow slip through. So I think the procedure is we do the minutes and then we give them to the clerk, Kelly, or the
I
city.
checked and they are all now posted. Some of them hadn't been published,
Oh.
so I checked and the last 6 meetings are definitely up there.
Great.
I
Thank
can
you so
check
much.
further and see if there's any others that might be missing or not published.
Yeah.
Yeah, we definitely do ours occasionally. We'll have some problems with the minutes and they'll be delayed by another month
Sure.
or so.
Mhm.
But we certainly do our part. And Kelly, you have to rely on someone else in the city to post them, right?
No, I can post them.
You can post them directly?
Yes.
Okay, good to know.
Good to know.
Any other questions or comments? Would someone like to make a motion?
I have a question, actually. I'm sorry. The next meeting is when?
Yeah, third Thursday.
January 16th.
Yep, 16.
Okay,
Or-
I'm not sure if I'll be there. I'm leaving very early the next day to be out of the country, so I'm not sure.
Should we do a little poll to see if a change in the date works for everyone? If we had a full roster of members, we would try to keep it the same day, given that we're such a small crew here. We need everybody.
We need 3 for quorum, though, right?
Right.
Yes.
I'm sort of, I know anything can happen to any of us, but I'm sort of like reluctant to change meeting times, but that's just me.
Mhm.
Because there's other things coming too.
Suzanne, you have thoughts about it?
Yeah, I'm with Cynthia on this. I think it's important for us and for the community that we have our meetings routinely. And we're going to have these problems. And while we're short a member, it's going to be even more difficult. If Janet, if you can't be there, you can't be there.
Yeah, it's pretty unlikely that I'll be there,
Okay.
but I certainly understand the need to continue, have the meeting.
All right. So Cynthia or Suzanne, if either of you, something comes up and you can't attend, then we won't have a quorum. Please let me know.
Thank you.
Otherwise, we'll move forward with this date unless something major happens. Would someone like to make a motion?
Move to adjourn.
No, we need to approve the minutes.
We didn't approve the minutes.
No.
We didn't approve.
Thank you,
Okay.
Kelly.
We
Move
didn't
to
approve
approve the November minutes of the Board of Health meeting
Second,
with amendments, sorry.
Second.
discussion? All in favor? Cynthia?
Yes.
Janet?
Yes.
Suzanne?
Yes.
Joanne? Yes. Approved. All right, would someone like to make another motion?
I motion that we adjourn the meeting.
Oh. Second,
Excellent. Any discussion? Questions, comments? All in favor? Suzanne?
yes.
Janet?
Yes.
Cynthia?
Yes, and happy holidays.
Yes, Joanne. Thank you very much. Have wonderful, wonderful holidays and a great new year. And we will see you all in the new year, hopefully.
See you next year.
Thank
Happy holidays,
you.
everyone. Have a great night.
Bye-bye.